A wider range of eye care will soon be available to Mid-South children. A grant from the Baptist Memorial Healthcare Foundation will help establish a Pediatric Eye Center. One of its targets will be the #1 cause of vision loss in childhood. Doug Johnson explains how it will protect your child's health.
Jalen and his mom are in from Marion, Arkansas to see his eye surgeon. See is a key for them. Because Jalen suffered from detached retinas, there was a question whether he'd be able to see at all. Retina problems are a leading cause of vision problems in children. Jalen's had several operations to restore his sight.
Well, the last surgery helped because I can see farther, not closer. I can't see closer, but before the surgery, I could see closer but not far, but now I can see far but not closer.
He needs his glasses to see close up. His mom says he'll be getting bifocals, which should help his close vision even more. Jalen says he's gotten used to having eye surgery, but that doesn't mean his mom hasn't been worried through the process.
It can be very nerve-wracking at times. Like he said, he's gotten used to it, so have I.
Examining, diagnosing, and treating retina or other eye problems can be tricky in children. That's because infants or other very small children may not want to sit still for an eye examination.
For anybody who's a father or a mother, they can understand that sometimes you cannot have your child cooperate as much as you want. And when you're doing something as complicated or perhaps as refined as examining a child's retina.
That's led to a cooperative effort between the Charles Retina Institute and Baptist Women's Hospital. Grant money has helped secure advanced eye examination equipment being demonstrated here in a patient room at Baptist Women's Hospital. The equipment is usually located in an operating room where a child can be placed under sedation.
That allows you to then do a full examination without the child fighting the examination. But at the same time, the critical thing is that for the sake of the child, you don't want to repeat the anesthetic events. You want to be able to do everything in one single setting.
Dr. Calzada specializes in retinal surgery, but says the technology can be just as effective for other eye treatments, including pediatric glaucoma or cataracts, because everything can be done at one time.
We make a diagnosis, very sophisticated diagnosis. But then not only that, we can now proceed on to the therapeutic phase, where we can do any sort of treatments that the child may require while the child is still asleep.
The single-stop aspect of the eye center, which has integrated care, has an impact on the logistics of care, meaning doctors, hospitals, and parents don't have to try to coordinate several visits for diagnosis and treatment. It's led to referrals to the Baptist Center from places including Missouri, Louisiana, and Utah in the U.S., and as far away as Central America. Dr. Calzada says there are discussions about bringing in patients from as far away as Europe.
We're not the only center in the United States that can do this, but we are the only center in the vicinity that can do this.
For Smart Medicine, I'm Doug Johnson.
Here are some of the stories we're working on for the next Smart Medicine. A new center for primary care is coming to Midtown Memphis. We'll have details on the new deliveries at a former post office. We'll have ways you can look good and feel great as we get closer to the warmer spring weather. And find out when pediatricians think your child's health requires antibiotics.